My name is Cassie Rourke. I'm a first year athletic training student at TLU. Today I'm going to be working on Hannah, who has patellar tendinopathy. I'm going to be doing the Maitland's mobilization, which we'll be using to decrease pain, spasm, and increase stability of the joint due to her lax patella. So if you zoom on in. We'll start with a grade 1. You're just grabbing the patella, and once you figure out what the full range of motion on either side is, you just move it slightly. Small amplitude motions for grade 1 for pain and spasm, and then grade 2, slightly larger. Again, you're trying to reduce the pain and spasm. Grade 3, we're going all the way through to the ends of the range of motion to increase the stretch in the joint. And then grade 4, small amplitude motions. Once we get to the very end of the motion, you're just going to add a little bit of overpressure. Same on the opposite side, again, to increase the stretch in the joint capsule.
Hi, my name is Hannah Wyman. I'm a first year MAT student at TLU, and today I'm going to be performing mulligans with movement for patellar tendinopathy. What this technique is used for is it helps reduce pain, it helps with abnormal kinematics, or movement within the joints. And so what I'm going to have the patient do is I'm going to have her put the knee that she's having pain with up. I'm going to ask her to lean forward, and she's going to tell me when she feels pain.
Okay.
Alright, so lean back. What I'm going to be doing is I'm going to be doing a medial rotation of the tibia. You want to find the tibial tuberosity on the lateral side of it, and you're going to slightly apply pressure, rotating that tibia. You're going to move forward again into that lunge for me. Was there a reduction in pain?
Yes.
So what we want to make sure with mulligan, when we are using mulligan with movement, we want to follow the pill principle, where it's pain-free, it's an instant relief, and that it's long-lasting. And what we're using definitely with this technique is we're trying to interrupt those nociceptive, painful stimuli by sending an afferent impulse to the brain instead.
Hi, my name is Angelica Romano. I'm a first year MAT student at Texas Lutheran, and today I'm going to be showing you how to do PNF stretching for the quad to help increase flexibility and range of motion within the quad, as well as neuromuscular efficiency when treating patellar tendinopathy. So we're first going to have the patient bring their heel up as far as they can go, and then you're going to push down until they tell you that it is good enough. We're going to hold this for roughly 20 to 30 seconds, and after that amount of time, we're going to have them push into our hand from their ankle with light pressure, so go ahead and do that. We're going to hold this for roughly 5 to 8 seconds, so keep pushing, keep pushing, keep pushing. Right, go ahead and relax. And then we're going to push a little further, tell me when, right there. And then again, we would hold this for another 20 to 30 seconds, really letting those muscle spindles relax and those create tension, and then have the Golgi tendons kind of relax those muscle spindles, and then we'll have them push up into our hand one more time for 5 to 8 seconds. Keep pushing, keep pushing, keep pushing, keep going. All right, go ahead and relax, and then tell me when, right there. And then we'll go ahead and hold this stretch for another 20 to 30 seconds.
All right, next what we're going to be talking about is eccentric exercises. These exercises are really good early on in rehab because they don't use a lot of motor units, and they still create a lot of tension within the muscle. Definitely for the patellar tendinopathy, it's good to work on those deceleration muscles, and that also helps. Eccentric also helps with that, and then also it helps with neuromuscular control because when creating that much tension using eccentrics, it helps activate that stretch reflex, which activates the muscle spindles and Golgi tendons, which helps with that neuromuscular control. And so the exercise that our patient is going to be doing today, she's going to be using the opposite or the uninjured leg. She's going to hook it around her injured leg. She's going to use this leg to lift up. So we're not activating this quad. She's going to let go. And as she's in that, yes, you're already doing it, going to slowly drop the foot. She's going to do this for 3 sets of 10. A way that this can be progressed is she can actively use this quad to bring it up and slowly bring it down. And then the next progression would be to add weight.
So now we are going to be doing a concentric exercise for the patellar tendinopathy injury. So we are going to have the patient stand with their feet shoulder width apart. And then we're going to have them just do a regular squat. And while doing this, we're going to primarily have them focus on the standing back up portion where the muscle ends up shortening, and doing this, we can help them increase their power and strength. So when they do end up being pain-free and they can return back to activity, they will still have strength and power necessary to do their activity. So a progression for this exercise is going to be jump squats. So they're basically just going to squat, and then once they come back up, they're going to jump. So for all of these exercises, we are going to do this for 3 sets of 10.
Okay, now we're going to progress onto closed kinetic chain activities. So what you're going to do is you're going to have your patient just begin with slide board lunges. So normally you'd have a board they can slide backwards on. They would hold a wall if they needed the extra stability, and they would just slide backwards down into a lunge. And their injured leg would be the one in the front that's actually bending. They would do this for 3 sets of 10, and then progressions for this would be you could move to walking lunges. You could add weight or even do explosive lunges for more functional activities. Closed kinetic chain is good for neuromuscular control. The co-activation of the agonist and antagonist muscle allows for increased stability and